Whenever a healthcare provider is providing care to patients, it is important to practice proper hand hygiene techniques. The healthcare provider should remove all jewelry from the hands and wash the hands vigorously with antibacterial soap for 20 seconds and rinse the hands under briskly running water. The hands should then be dried with a paper towel. Another alternative and acceptable method for practicing hand hygiene is to use alcohol-based cleansers. Remember to rub a generous amount of the alcohol-based cleaner on the hands and forearms, and then wait until the material air dries before providing care to the patient. This patient returned to the office for a wound inspection 12 days after the incision and drainage of a pilonidal abscess. The patient had no complaints of pain. The pink tissue that protrudes from the skin is called granulation tissue, and it prevents the wound from completely healing. Granulation tissue is an overgrowth of one of the normal elements of wound healing, namely small blood vessels. The overgrowth of the small blood vessels forms a mechanical barrier to the skin cells that are attempting to close the wound. Destruction of the granulation tissue permits the skin cells to grow and cover the wound. This method of wound cauterization can be performed safely in an office or home setting. This small wound resulted from an incision and drainage of a pilonidal abscess. Wounds such as these incision and drainage wounds do not frequently heal entirely without some additional care and treatment. Granulation tissue protrudes through this wound and needs to be treated with silver nitrate cauterization. This treatment is generally not painful as long as the treater does not burn or cauterize normal skin. Under most circumstances, patients will not need to take antibiotics during this phase of their treatment unless extenuating circumstances are present. I'm putting a little bit of silver nitrate on there for you so we can get this thing to heal up all the way, okay? Of course, most patients are appropriately curious and concerned about how many treatments with silver nitrate may be required. The answer is that usually several treatments are required. Generally, the treatments are given at 5 to 7 day intervals. In between treatments, the wound should be covered with sterile dry dressings. These dressings should be removed and changed twice a day. After they are removed, cleaning the wound in the shower and letting the shower bath water run through the wound is a good way to take care of the wound. The shower bath water will help remove debris that occurs during the healing and cauterization process. We are now looking at the wound 5 days later, and an additional treatment of silver nitrate cauterization is being applied to the granulation tissue. Notice that the wound is also decreasing in size as the wound healing progresses and the cauterization of the granulation tissue is successful. Again, 5 days later, the process of cauterization of the granulation tissue was repeated, and the wound, as one can see, is continuing to further decrease in size. Patients will frequently ask, how long will a scar be red and raised? Well, remember that scars mature slowly. You can expect your scar to gradually get less red and maximally decrease in size in about 1 year. Patients are also concerned about resuming normal activities. Now, when the wound is healed as it has in this photo, the patient may resume all regular activities such as taking baths, using hot tubs, and performing all types of exercises. This wound completely healed over the course of 6 weeks. Remember, do not resume using swimming pools, hot tubs, and so forth until the wound has completely healed. To do so before the skin has completely healed would be risking unduly the infection of the wound from any bacteria that might be in the water in which the wound is being immersed. Then to also remember that good hand hygiene technique requires that the treater clean the hands both before and after treatment of the patient's wound. Thank you for your attention to this video, and I hope that it serves you well.